So let's talk about pain around your surgery and pain management. So this is not going to be a section about all the kind of amazing and incredible research around how we're coming to understand modern pain theory, but there's a few things we want to do. One is that we want to mention and talk about sort of the subjective nature of pain. We'll start here. So to begin with, it's completely reasonable to be fearful or have some anxiety about how much pain will happen as a result of your surgery. And you and your physician and your physician's assistant are probably have a medication pain plan to help you get over those first few days of surgical insult. We also want to just make sure that we're appreciating as we load these tissues that discomfort in the tissues as part of the rehab process and completely a normal experience, and that you may have some discomfort as you continue to load this thing all the way out, as we talked about, for 2 years, that you load and the tissues have to adapt. And finally, we want to just say, what are the tools available to me to help manage this? So first of all, pain is a highly subjective experience, and that your personal beliefs, your personal history of pain, your cultural beliefs around pain, how stoic your grandmother was, your nutrition, your genetics, all of these things aggregate into a different personal experience. And so two people can have the exact same surgery and have very, very different perceptions of the threat, depending on, again, a lot of previous experiences, beliefs, expectations, etc. So what we like to do is say, hey, tell people right up front, it's totally okay to have some pain. Remember that pain is a protective mechanism. It's trying to get you to fidget, trying to get you to move more, it's trying to get you to stay out of position. The real question is, should we have no pain? Should I just be numb? And clearly, we're in the middle of another opiate crisis. And so we're just trying to say, hey, if we're going to remove opiates from the conversation, and they're very potent and very appropriate during surgical pain, believe it or not, surgical rehab, what other tools do I have available to me? So keep in mind that what we're trying to do is manage pain to a reasonable level where you can sleep and you can eat and you're not nauseous and not knocked down. We actually do find that people can potentially be too far on the other side of, I don't want to feel anything, and then they don't move, and then there's real problems with even dependency or coming off. Plus, a lot of people in our community report that they feel terrible on opiates. So we're just trying to say, hey, look, we think that this is a problem that, that how am I going to manage this in sort of the twofold approach of movement and tools at home, plus the real and added benefit of the medications that my physician is providing me. Now, we've never met an athlete who says, I like to take pain meds. No one ever says that. It just doesn't happen. So keep in mind that if that's you, you're in good group here, that people are saying, hey, I really want to minimize those things and minimize their impact on my motility. If you've ever been constipated from taking pain meds, you'll do that one time, and that's a real concern. So typically, we try to look and say, what are the impacts on the body here? So we're trying to not limit our healing. And non-steroidal anti-inflammatory drugs like ibuprofen potentially can limit my body's healing response. And again, your physician is up to date. She is up to date on the current research here. But believe it or not, Tylenol and opiates are actually a better healing response potentially than taking big doses of ibuprofen. So just keep in mind that some of the opiate response pain relief can be really helpful for a few days and help you just sort of manage that, especially in conjunction. I think it's safe to say that, in conjunction with all these other tools, it's safe to say that our goal is to say, hey, what's the minimum amount of sort of medication I can take to support moving and desire to move? If I have a lot of pain because I'm afraid of taking meds or I'm trying to be stoic, and I'm not going to get up and move because I'm just feel like I'm really, really limited by my pain or fear of pain for movement, then what we're going to see is that actually causes us a delay in moving and returning to function. So your experience around this will be highly subjective. We've had friends who've had total hip replacements but are allergic to all pain meds and have managed all their pain with high doses of turmeric. So all the way from hip replacements with turmeric all the way to I have very, very sensitive athletes who have to sort of manage and dance this way. When we're looking at the tools that are available to me for on-demand comfort, on-demand pain relief, we can sort of look at them in sort of a couple categories. One, we've always talked about heat, and heat is very safe. We're not gonna burn the tissues with a heating pad, but that can definitely be an analgesic, which means a pain reliever. Vibration can also be useful if you have access to vibration. And of course, I can't be in a vibrating bed or vibrating 24/7, but sometimes people just need some relief. And getting in some vibration and motion can interrupt how the brain is receiving some of that signaling from the body. Remember, one of the reasons that the nighttime is so tough for many of us is that we're not moving, tissues are congesting, and then we have this sort of twofold, is that the tissues are continuing to congest, and I'm not getting any movement. So that pain and movement signal in the brain, usually the pain signaling may be canceling out or attenuating or sort of diminishing some of the pain signaling. And what's ended up happening now is I've taken the movement out and my brain is only getting this pay attention to me sort of issue. So vibration can be really, really nice sort of relief temporarily. You can slip that in, get some vibration if you already have a vibration tool. In the training, using the blood flow restriction, which we'll talk about in another video later on, can have some powerful analgesic effects. And that just could be, we're just pumping up the tissues with blood. The brain is like, let's go. So we can see that sometimes during training, this can be really help some of our athletes to feel better. And then we're left with what I think is one of the sort of my favorite ways of managing post-surgical pain, and that's with this FDA-cleared H-wave device. And this device actually has two settings. It has a low frequency and a high frequency. And oftentimes, one of the reasons we love this is that if I can give someone some pain relief, I can run these pads, run the system at high frequency for 45 minutes to an hour or so, and then I can take a break for an equal amount of time, but I can have pain relief that lasts multiple hours after. So what I've done is here, and just imagine this is my knee, putting a pad on either side of the joint, put some high energy through the joint. And what it ends up doing is it feels numb. So as I turn this on to high frequency here, what ends up happening is I start to get tingling and numbness through the joint. So I can still move, I still have volitional control, but basically wherever I put the pads, I'm going to have a similar experience. It needs to reset. Put a similar experience between the two pads. So if I have an area and I have 4 pads, I could cross that. If this was my spine, I can put it on either side of the spine safely. If I had an incision, I could go either side of the incision. But what this does is allows me to create opportunities where I physically am getting the on-demand pain relief and I get lasting pain relief. So FDA cleared, chronic pain, even persistent pain, and it's a very, very powerful tool we've found to help our athletes be able to manage that post-surgical trauma pain and have fewer drugs on board, which is really powerful. So sometimes you're just like, I need a break, and we can put some high energy in that. And it's very easy to use. The H-Wave comes with concierge setup. You can call the company. It's very, very simple. They'll even talk you through it. But one of the things that I think is worth talking about here is how am I going to manage my 24-hour cycle of sort of swelling management, movement management. And one of the biggest opportunities we've found in our clinical experience to help people have less pain and better function is to actually utilize the sleep as an opportunity to continue to decongest. So if you have any NMES device, this one, again, with a low frequency setting, basically allows me to create a non-fatiguing muscle contraction. Let me turn this on to low frequency here. And what this will do is give me an opportunity to get some low frequency movement in here and pumping so that I'll get a non-fatiguing muscle contraction between the two pads. And what this does is this non-fatiguing muscle contraction between the two pads means that I can stay away from a tissue I'm trying to protect, or I can work above and below. Because the lymphatics are draining to the heart, basically, through any of the limb, the whole foot drains up through the leg, the elbow, the biceps, shoulder, all drains through the same system. Any contraction or pumping in the system allows me to continue to decongest. So what ends up happening then is I can safely wear this thing 20 hours a day or longer, and I can definitely be decongesting all night long. So my own experience was that some of my best rehab was happening during my sleep cycles, that I could put a pad on my quad and just get a low-grade muscle contraction in my quadriceps, which allowed me to sleep, and I was decongesting all night long. And also, because I was having movement, my brain wasn't just inundated with sort of a pain experience. So one of the things we're trying to say here is, how am I setting myself up for sleep? I talked about earlier that pain is actually a protective mechanism, and that when we are getting pain in the night, that's okay. I think a lot of us panic and freak out that we're not gonna be able to manage that. And clearly we wanna have appropriate pain meds, appropriate tools ready to go, so that I'm not waking up in a cold sweat at 4 in the morning, dying, waking up my partner, or doing it alone. But we wanna appreciate that there's a real opportunity to continue to decongest and get this tissue moving all night long, so that I wake up and I feel better and I have had better sleep. So if we can get better sleep and better decongestion, then what we see is total sensitivity comes down. Plus, we have the added benefits of less congested tissues, which are healing faster tissues, and potentially are less sensitizing. That means that swelling isn't driving a lot of pain signaling to the brain. So again, you might have other tools. I just want to create a framework for you to understand and sort of begin to wrap your head around, how am I going to manage this post-surgical pain, and what can I use or deploy those tools throughout my rehab process? As I challenge the tissues appropriately, they're going to have a reaction, an adaptation to that stimulus, and they're probably going to swell again because we've disrupted the associated vascular networks. We've cut through all the capillaries, cut through all the lymphatics. So it's going to be a dance between load, recovery, load, recovery. Initially, we're thinking, hey, it's just post-surgical pain. I'm out of that. It's fine. Most people usually get out of it in 2 or 3 days, very fast, sometimes upwards of a week. But can I bring that down, tamp that down, and use the same sets of tools all the way through my rehab process? Hopefully, this gives you a little bit of framework around thinking and having appropriate expectations around your post-surgical pain. If you have any more questions, of course, ask your physician.